Isle as an example. Businesses that certify as taking these precautions can operate as if they were in yellow, so 1 degree less restrictions. And Colorado Department of Public Health and Environment began accepting applications today, and the very first one to be approved is Summit County in time for this weekend. And whether or not a program like this is right fit for a particular county, I want to encourage everybody to support our local restaurants by doing takeout, delivery, eating outdoors. It's a great way to support our iconic local businesses. We order in 3 or 4 times a week, and we're very proud to support our local restaurants.
Must be nice!
Now I'd like to turn it over to Dr. Herlihy to share some of the latest trends that we're seeing across the state with regard to the health crisis and the trajectory of the deadly virus in Colorado. Dr. Herlihy?
Thank you so much, Governor. Good afternoon, everyone. So as we walk through the data today, you'll see that our numbers remain high overall and call for continued action, but we are seeing improvements. Next slide. So this figure shows you our case counts in Colorado. In gray, you can see our daily case counts with each of those vertical bars. The red line shows you our 7-day moving average for our number of cases. In this figure, you can see a clear peak in mid-November. You can see a small increase in cases that occurred in early December.
All right, so it's getting worse and worse. This is the COVID-19 generation, the Kung Flu generation. This is going to be the issue that defines our times. It's changing our behavior. Wearing a mask isn't that big of a deal. A lot of these countries have already beaten the motherfucking thing. If we all got on in unison and, mobilized the public and mobilized the government and got on this fucking thing and handled the shit. But that's the problem, is American government doesn't respond to the American people. American people's got a crisis. Maybe the American government might help. Probably won't. Probably not. So that was Jared Polis giving the update. COVID is still a fucking problem. It's a big problem. And it's getting worse, but it's, they're testing. So Jared Polis is, speaking off of information, data, driven research. So data-driven research, Jared Polis says, do take out, help the local businesses, but still, COVID is extreme. I got on my phone, actually, some sort of app. You want to sign up for the COVID app? It's like, social tracing. I'm not into social tracing. No, I'm not going to get the COVID app. That way we'll tell you which areas are real danger. New Mexico's real terrible. Castilla's, this area, this is a poor area, so I would assume where I live is really bad. They're saying it's bad in Colorado. It's bad in America. It's probably bad in every goddamn state. All 50 nifty of the United States is probably having problems, and it's probably worse for the Republicans because they're not doing the testing, don't have the right information, and they're like, oh. So what would be the best, you never waste a good crisis. So you got a pandemic, a big health crisis, a big health emergency. We don't have universal health care. The economy is tanking. We need $2,000 per month to save the American people. And the police are still killing people. So those are the 3 issues. The force to vote, let's get universal health care. Let's stop police brutality. Pass something to put a dent in police brutality. And let's get $2,000 for each and every one of us. What, $1 trillion for war, endless war for the empire, yet we don't get a fucking peanut? And if we do get a peanut, we have to forego our civil rights and labor rights? The rich are organized, they have all the fucking money in the world, they'll have a place at the table. The question is, will the working class have a place at the table? So there's an update, Jared Polis, on today, December 18th, 2020, Friday. Peace.